Now please help me welcome Dr. CJ Crisp from Little Rock, Arkansas to discuss patient services.
You may have noticed by now that there's a trend that most of us want to practice medicine and we don't really want to do business. So I started off in psychiatry, and somewhere during the course of that, I got a little bored and a little tired of doing psychiatry, and I started exploring some aesthetics because it seemed kind of interesting at the time and it was kind of new, although there were still a lot of people doing it. In the process of doing that, I came to Las Vegas one year for that, but ended up going to a hormone replacement therapy session and was very intrigued by it. I'd already been interested in doing hormones and the interface between hormones and the brain. In fact, when I was a resident, I think I had done my grand rounds on periodic menstrual psychosis, and you can imagine that there really wasn't a lot of information on that. But so that really kind of lit a fire under me, and I started, as I was practicing psychiatry, started doing the fellowship and did the basic modules, and about the time I had finished the fourth one, I'm thinking, I have no idea how I can add this to my practice. I think it's really valuable. I see lots of women, I see lots of patients. They don't seem like their antidepressants are working. They don't feel like their anti-anxiety medications are working, and I don't feel like I'm helping anybody that much. So I really was working in a community mental health-based setting. I couldn't even order a blood sugar half the time, much less a saliva test and blood work and all of that. And just the thought of having to figure out how to do everything was pretty overwhelming for me. So just about the time I had finished the fourth module, I came to a similar one of these conferences and listened to Patrick talk and the former chief medical officer talk. And I got chills. I felt, wow, this is how I can add this to my practice because this will handle the business aspects of it for me. So today I'm supposed to talk a little bit about how they do that and patient services, which is a team of people that are based in Boca Raton, Florida, that work with all of us across the country. And what they do is they handle a lot of the day-to-day operations for us and that make our practices run smoothly. For instance, in Little Rock, Arkansas, I have one person working in my office. She answers the phone. She schedules my follow-up patients. She collects the payment at the end of their visit and does a few other office managerial type things. But for the most part, the majority of the day-to-day practices are run out of Boca. So there are some basic functions that are served there. There's prospectors that handle initial consultations. And they talk to all of the prospective patients, hundreds sometimes a week. They talk to them about the costs, about the labs that are going to be ordered, about the time that they're going to have to invest. They get all of their information. They collect their payment. They order their labs, which I have already pre-ordered because all new patients get a certain set of labs. Men get one thing, women get another thing. And they take it from there. They get them all set up. They set up their initial consultation. They let them know when it's all going to happen. Then from there, the next person that takes over for that new patient is the lab chaser. So that lab chaser follows that new patient and makes sure that they're getting their labs done. And they call them and remind them if they're not doing them. And if they've not been done in a timely fashion in time for them to get those labs into my electronic medical record, they reschedule the patient as needed, and then as the holes start to appear in the schedule, because people don't always do what they're supposed to do, they'll try to fill in my schedule. So then that patient comes in. When they come in, they have their labs, they have their medical history and the EMR, they have, and we can actually sit down and I can spend an entire hour talking to that patient about what we're going to do, make a plan, and give them a treatment plan when they walk out the door. So when they walk out the door, I have to look at, when I want to see them back, what labs I want the next time I see them based on the treatment that we're doing. And I don't really even have to think about it after that. We set their appointment. I order their labs. I order their medications and their nutritional supplements if I want them. And from there, a follow-up person comes in and follows that patient. So when it's time, before it's time for their next appointment, someone is calling them and telling them, hey, it's time to order your labs. This is how much it's going to cost. They take care of getting it sent to them. And it's pretty seamless for me. So by the time I see that patient again, their labs are in the electronic medical record because my chasers, once again, followed that patient, called them, made sure that they did their labs, and got them, on my schedule and tried to fill in the holes as they could. So that, in a nutshell, is kind of what happens with patient services. And it is, just thinking about it today when I was talking about it, I kind of got a little bit overwhelmed. I thought there is no way I can talk about all of everything that they do. So, but there's a few other things, and people are going to go into a little bit more depth later on about this, but there are patient services that also help with auto orders or prescriptions. They help with auto ordering the supplements, which help people stay on their programs. We have claim assist, they file insurance, and then there are other business aspects to it, like the technology, the electronic medical record that we work with, business analytics that are done on a regular and consistent basis, and then accounting and billing as needed. And that's pretty much it. Thank you.